Welcome to the medication administration process video. I've just wheeled my cart into the patient's room. I've also just done hand hygiene as I entered the room. So I'm at the bedside now of Mr. Fred Smith, preparing to give him his 0800 medications. This morning he will be getting 2 pills, and I will demonstrate the process of doing that. Good morning. My name is Linda Fluffin Pooh. I'm a registered nurse here at John Tyler Community Hospital, and I'm going to be giving you your 0800 medications. Can you tell me your name and date of birth? And so he tells me his name is Fred Smith, and his date of birth is 3/2/1931. That matches my EMAR, so I'm happy about that. I'm going back to the med cart, where I'm going to compare the medications, the EMAR, to the physician order form. And I have 2 medications to give: Practi-Loten, or Lotensin, a blood pressure med, 20 milligrams at 0800, and Practi-Colace, 50 milligrams every 12 hours, and a dose is due at 0800. So both of the orders on the EMAR correlate with what the physician wrote on the prescriber orders. So I'm going to my box of patient meds, which I have pulled from the med cart. And the first med I pull is Colace. I read it. It is Colace, 50 milligrams. And I'm going to lay that down right next to my MAR, where the Colace is. Then I'm going to pull the Practi-Loten out. There's a whole pile of these. And it's 20 milligrams, and the physician has ordered 20 milligrams. So my first check is pulling them out and laying them next to the EMAR to the particular drug. I'm going to then look at them again and make sure I have the correct meds. At this time, I'm also going to talk to my patient and ask him about his medications. One of the things I'm going to ask him is, related to the Colace, is when was his last BM, and he tells me that he had a BM last night and it was relatively formed but a little bit on the hard side. So we have a brief discussion, and I say, Mr. Smith, I'm going to give you Colace this morning. It's a stool softener. It sounds like, since your stool is not quite soft yet, that you might want to consider taking it, especially since you're also getting narcotics for pain management. So I've looked at that already twice, and I'm going to pop it into my medication cup. My other drug is Lotensin. It's for blood pressure. And right before I came in the room, I took a recent blood pressure. I don't want to use an old one because I'm choosing to give him a drug that's going to lower blood pressure. So I want to make sure that I know what his current BP is. And his blood pressure is 138/84. It sounds like you do need your medication, since I noticed that your baseline is typically lower than that. And he agrees with me. So I have 2 meds in the cart, in the little box, the little pill container. I have checked their names, their drug names, their doses, the expiration date, if it's on there. I checked them once when I laid them out on the MAR, and twice, a second time just now. And now I'm really ready to give the drugs to the patient. He has a glass of water, which I will hand to him. And then I'll ask him, do you want to take your meds all at once, both together, or would you like them separately? And he says, whatever. So I open them up, and I say, this is your Colace, 50 milligrams. I pop it out of the little container and put it in the cup, as I'm also checking the EMAR. And then the Lotensin, 20 milligrams, 20 milligrams. I pop that too in the cup. I ask him if he has any questions before he takes them. He says no, so he takes them, swallows them, and so they're gone. I come back to the med cart, where I will document the time is 0800. So all I need to do is put my initials down next to the 2 drugs that I gave him. If he has any other nursing questions or concerns, I can answer them while I'm there. Otherwise, I'm free to leave the room. I tell him I'll be back in a little bit later to check on him. We'll probably be rechecking his blood pressure in a couple of hours to make sure that it has not gone too low. So, this would be Linda Fluffenpoo signing off for the Med Administration Process video.